Hi, I'm going to talk to you about a couple techniques to control or help to manage headaches. One is, they're both by Brian Mulligan, an excellent New Zealand physio. And the first one is usually one of my go-to techniques for headaches. Oftentimes for cervical neck headaches that start from the neck and go up into the head, and or tension headaches. So what you have to have is a pillowcase. Really simple. Just take the pillowcase behind you, gently pull it so it's not catching anywhere. The edge of the pillowcase goes right along the first bump of the first vertebrae you feel just behind the spine. So if I feel the head coming down, right there is the first bump. The edge is going to go there. Now this technique is very gentle and it's not aggressive. I often see people grabbing the pillows this way and holding. It's just your fingertips holding, keeping still there. What you're going to do is almost making a little nod with a chin tuck. So I'm sliding my head slightly back as I tuck. So I'm going to come in and relax. So that's the technique. I'll show you from the side. It's not aggressive, it's really light and gentle. Oftentimes we'll tell patients to do that 10 times in a row, 3 sets. If you attack the headache early enough, that should be enough to calm it down. And that really is a very gentle exercise and a good way to manage headaches. Now the other technique I'm going to show you is a pillowcase, and it helps with restricted neck movements, especially if it's rotation really. So if I was stiff rotating to my left, what I would do is take my left hand this time and hold the pillowcase. It stays at the same place just off that first vertebrae, just below the base of the skull. The right hand, my left hand is anchoring down here. My right hand is going to hold the edge of the pillowcase. Again, I see people doing this. Really, it's the edge that's being used to guide, and we're going to guide your vertebrae in movement. Sorry, I'm showing you for right rotation. So I'm on the left side with my right hand, and my left hand is holding, anchoring on my chest across. What I'm going to do is turn my head to the right, in this case, because I'm restricted going to the right. So I'm going to turn my head and hand at the same time. The pillowcase should, on the left side here, should remain parallel to the ground, not down and not up. So along the cheekbone, my face is always going to face, my knuckle should be just of this finger, should be just in front of my face. And as I turn, my back's not going to twist, but I'm going to turn my head with my hand coming across, guiding. And it's a very gentle, gentle pull. It's just my fingertips. I'm not forcing over here. I don't need a lot of force. You're just reteaching movement here. You're educating, you're giving some feedback to the muscles around the neck and the joints around the neck to know what to do. So we're going to, again, oftentimes the first time I give this might be a set of 6 and 6 reps times 3 sets. Oftentimes we'll do 10 times 3 and maybe a few times a day even, just to regain range of motion for the first few days, and then filtering down to once or twice a day of 3 sets. Okay, really gentle movements, really gentle activities. That's how you can do those with a pillowcase. There are, if you look in Brian Mulligan's websites, he also has these little bands around here, which are really good. They do the same thing. I'll show you the reverse direction on the rotation mobilization. So this is in the same spot. My hand's exactly the same, except this time I can turn and stabilize. One hand down below, stabilizing. One hand level to my cheekbone and turning and stabilizing. Just my neck is going to turn. Nice and smooth 10 times. Now, there's one more activity that's not listed on this sheet that I do a lot for when we get wry neck, or that, you wake up with that really stiff neck and your head is a little twisted and tilted and you can't, for example, turn to the right. So if I was stuck turning to the right, what I would do is very gently get in a tall position, tuck my head down, turn gently as far as I can go comfortably. When it starts feeling tight, I'm going to do little tiny nods. So I'll do little oscillations, about 20 oscillations. When that loosens up and it'll feel a little better. I'll go a little bit further and do those oscillations again. Okay, then I'll do a third set of 20 oscillations, each time getting a little further, it feels a little better. Then I'll come back to the front. That exercise I often tell people to do every hour, 3 sets of 20 little nods every hour, or at least every 2 hours when they wake up with that wry neck. If it starts after doing a few sets of those, a couple hours, if it starts getting more sore, I wouldn't do that and I'd go see your physiotherapist. If it starts to feel relieving, continue for 1 to 2 days. At that point, by the second or third day, your wry neck symptoms will be gone. Usually with this alone, it's 1 day, the next day it feels way better, much better. And so that's a nice simple exercise you can do before having to go see a physio or anyone else, any other health professionals. If it doesn't abate or settle down, then you can call the physio or your physician. Remember, anytime you have significant pain or problems, your physician is your primary go-to person, and then physio or chiro. Thanks.